Honorable Member for St. Michael, South Central.
Thank you very much, Mr. Chairman. I have 3 questions in my first round of questioning. These are very simple and straightforward. Some of them were touched on by the ministers and their teams earlier, except I'm asking for a little bit more specificity. Let me start with 2 issues that are critical for the government of Barbados, or that have been, especially with respect to the Barbados Economic Recovery and Transformation Plan. Under the BERT program, under the BERT plan, the government and its statutory, state-owned enterprises, statutory institutions are not to accumulate arrears. Now, the accumulation of arrears is an issue of financial governance, is one of the reasons that we had these arrears targets under the BERT plan. But it's also an issue of small business growth and development, because we know well that a business that has outstanding receivables is also not able to reinvest those resources in growing and in its general day-to-day operations. So I ask this question from the perspective of not just meeting our requirements under the BERT plan, but also making sure that we are true to our word when we talk about supporting small business. And it is this. There are many people who have reached out, not just in my capacity as a member of parliament, but also in terms of what they see as my association or former association with the Ministry of Finance and with Economic Matters. And their concern has been the issue of their own receivables from the Queen Elizabeth Hospital. So these are providers to the Queen Elizabeth Hospital, supplying essential goods and services, who themselves have issues with their own cash flow and with their own reinvestment in their companies because they have outstanding receivables from the Queen Elizabeth Hospital. And before the minister comes back in to repeat the issue of scarce resources, I want to emphasize that this is not a question of the quantum of resources. This is a question of the financial and economic governance of the QEH, and making sure that the cash flow matches and the financial management matches your commitments. So I would like to hear a bit about what are the challenges there. I would like to hear a bit about how that is going to be resolved in this financial year. I hear us talking about things that we are looking at and things that we are considering, but I want to remind us all in this honorable chamber, if I can, through you, Chair, that we are looking at the estimates of revenue and expenditure for the year 2022 to 2023. We are discussing what we are executing in this financial year, and so related to that, not just the issue of receivables from the QEH that are outstanding as a perpetual issue, but I would also want to hear quickly what is the CapEx, what part of that 125 million that is allocated under subprogram 375 for the QEH, what part of that is CapEx in this financial year, and what is it going to be spent on? Thanks.
Thank you, Honourable Member. And I do agree with you. The BERT program stipulates that we must not carry any payables beyond the agreed time frame. In respect of the Queen Elizabeth Hospital, the Queen Elizabeth Hospital receives a transfer from the central government, as I indicated, in the next financial year, of approximately 125 million, up 5 million from the 120 in this financial year. The second issue is that the Queen Elizabeth Hospital benefits from the health service levy. I think when we look at the projections, it would have been upwards of about $55 million that we're projecting to gain in this financial year. Obviously, with increased economic activity in the forthcoming financial year, we presume that we can get back to maybe above the 55, maybe hopefully $60 million, obviously depending on the level of activity out there. Other revenue from the Queen Elizabeth Hospital amounts to approximately $3.1 million in this current financial year. when you sum that total, you're talking about just approximately about $183 million. Now, with $183 million, currently when I review the hospital's P&L, the hospital funding requirements are approximately in excess of $200 million. So before we do anything within the financial year and the forthcoming financial year, we will be looking at a deficit. Now that has implications for cash flow, and therefore the accounts payable at the Queen Elizabeth Hospital will always be a difficult exercise to manage. Having said that, we have to look and put our financial brains to work in an attempt to address the situation. How are we going to address the situation? We have to, first of all, secure additional funding for capital expenditure. We can't look at the $125 million to, carve out any of that specifically for a 5-year or annualized capital expenditure plan. Because at the Queen Elizabeth Hospital, 70% of whatever is required is allocated to labor costs. So you start at a position where 70% is labor costs, and then you have to look at the other operating costs and utilities, etc. So in summary, we want to improve the accounts payable situation at the Queen Elizabeth Hospital. That can be assisted if we request supplementary funding from the government, and we can get that supplementary funding. If we can't get the supplementary funding because we know that the other government departments making a call on the consolidated fund, we have then to look at other income. And in the forthcoming financial year, we have to get back to a situation as obtained in the past where the Queen Elizabeth Hospital was able to rake in at least $12 million in other revenue. And we now have to devise strategies to ensure we can enhance other revenues. Now, we also have a situation whereby there are persons who have healthcare insurance. And what I think we should do is we should have a situation at the Queen Elizabeth Hospital that encourages persons who have healthcare insurance to apply that healthcare portion to assist the Queen Elizabeth Hospital with their revenue enhancement position. And I think that if we can get that done, I think we'll be in a better position. But I can't guarantee that in the next financial year that we will not be in a position to pay all of the payables unless we start that gradual process of improving other income and improving other income as they did in the past, like I said. But we also have to start thinking about out-of-the-box commercial approaches. If we get a capital expenditure program approved and we are able to reduce some of the recurrent expenditure that we have on, maintaining equipment that perhaps ought to be replaced some years ago, if we can start looking at other efficiencies. But I warrant to you that along with Minister Brown, Dr. Brown, that we will be paying acute attention, and we are going to be putting all of our commercial and medical skills to work to hopefully bring this situation under some level of control. As I indicated in my opening remarks, the heads of departments will have to account for their spend, and we're going to have to be very judicious about that. The hospital is no different from a hospitality environment. It has occupancy, it has other costs, and we're going to have to start reviewing the costs, all costs within the Queen Elizabeth Hospital to see how best we can create a more efficient management system. So I will endeavor. I can't tell you that we will accomplish and pay everybody before the end of the financial year, but certainly what we will do is not to violate the program in the first instance, but we will try to seek out other revenue, other income for the Queen Elizabeth Hospital as we move to improve the standing of the Queen Elizabeth Hospital in the public eye. Thank you.
Thank you. Thank you, Minister. I didn't hear a CapEx number that you're targeting for this year, but I do hear you that some of your decision-making seems to be a bit fluid in that regard. I'm happy to hear that you intend to settle the issues of financial management. Just to say quickly that based on some of my conversations with the small business sector, with the business sector really, I think that these matters are urgent. If we consider that these are companies that are supplying, in many cases, medical goods and services, we will then have to hope that they're able to sustain their good faith relationship with the government of Barbados or with the QEH, because the moment that they make a decision based only on their own profit or their own business decision making, then the people of Barbados will be in a bad position. So I just encourage us to try to be able to settle those issues, because these are companies that need to prosper and grow just like anybody else. I'll move quickly to my